Hi there, my name is Savannah and this is my newborn head to toe video. Hi there, my name is Savannah and I'm here to do your nursing care today. Can you tell me your name and date of birth? Can you tell me your baby's name and date of birth? And you'll be checking the name and date and making sure that they match. Next, I'd be performing hand hygiene and putting on clean gloves, and then I'd be explaining briefly what I would be doing. So to start, we're going to be looking at the baby's head. We're going to be looking at the anterior and posterior fontanelle. And there can be a little overlapping that will subside within 24 hours. And then there can also be caput succedaneum, which is when there is a fluid that covers both sides. So if it's just on one side, that is something that we're gonna wanna note. And that is not a normal finding. Next, we're gonna be looking at the eyes. We're going to make sure that they're open, that they're symmetrical, that they're in line with the ears. Next, we're gonna be checking the ears. We're gonna check the pinna recoil. And then we can, again, check for symmetry, do our oral reflex. They should startle, and this is also checking to make sure that the baby can hear. Next, we're going to be looking at the nose. We're going to be plugging one nostril at a time, checking for patency and making sure they can breathe through it. Again, checking for symmetry. Next, we'll be doing the mouth. So we'll be putting our finger in their mouth, checking for the sucking reflex. We can also feel the top to make sure it's smooth. There may be Epstein pearls, which is a normal finding, along with teeth, which is also a normal finding. Next, we can do the rooting reflex, which we graze the cheek, and then they should be turning towards the nipple or the finger. And then after that, we are going to be checking the neck, making sure that our range of motion is good, and then you will also be turning just like this, and then wherever it turns, that arm should be straight, and then the other should bend, and that's our tonic reflex, and you'd be doing that to both sides. Now we're going to be checking the clavicle, making sure that's all good. And then we're going to be checking for our range of motion in the arms. We're going to be checking to make sure that we have 5 fingers, same with our range of motion with the legs. 5 fingers, our plantar palmar reflex and our plantar reflex. They curl over. Our Babinski go out. Again, our pulses, brachial and femoral pulses, making sure that they are the same length. Again, range of motion. We'll be looking for our muscle tone as well. Next, we're going to be looking at the chest area. There could be dimples and they could be up a little bit, and that would be a normal finding. There could be a little bit of discharge as well, which is also okay to find. And then we'll be looking at our abdomen. So for the umbilical cord, there should be 2 arteries and 1 vein. You're going to want to look for any signs of infection, educate that you shouldn't be pulling on it, that it will turn dark and crusty later, but even then you don't want to pull on it. There will be a little bit, there's common for there to be a little bit of distension in the abdomen as well. And so we're going to start with our vital signs. So we're going to be listening to the apical pulse, which should be between 110 and 160. And then we're going to be listening to our lungs and our breath sounds, again, for a full minute for both of those. And then our breath should be between 30 and 60, and it's normal for it to be irregular. It's also normal to hear a heart murmur as well. And then obviously we'd be doing our vowel sounds in all 4 quadrants. And then those should be normal active. And then after that, we would be checking our temperature. So we would be putting our probe right here, not here, right here, and it should be 97.9 to 99.7. And that would be a normal finding. And be also educating on how to keep your baby warm. Next, we're gonna be looking at our like hips. So first we're gonna do the Barlow, which is go down and then open or Tilani. And then we're going to come around, and there should be no clicking or popping of the hips. And again, checking our lengths of the legs. Okay, and next we're going to do the genitalia area. For a female, there can be a pseudomenstruation, which is when it's just like a period basically for a little kid. And then you're going to want to see if there's any discharge. You're going to want to make sure everything's even down there as well. For a male, you're going to want to test the scrotum, make sure that there's a testy in each. Check for any discharge as well, making sure everything's even. As well. And now we're going to turn our baby over, not covering the mouth. We're going to be looking for any slight gray nevi that could be on the back. We're going to want to note that. We're going to want to make sure our spine is symmetrical, that everything is symmetrical down here as well. Also going to be checking the anus. Again, the gluteal folds. And just for any other skin markers, that's what we're going to be doing the whole time. And you're also going to know when they have their first bowel movement, because that's how we know the anus is patent. And then for the skin, so for the color, it is normal for them to have like bluish extremities for the first 24 hours. Then we're going to want to look for vernix, which is like a cheesy covering. We're going to look for, again, like milia, which is like little acne that's common on the face. Erythema toxicum, which is like the red dots, which are found all over. The telangiectatic nevi, which looks like blood vessels found all over. And then again, the slate gray nevi. We're going to want to note that as well. So we did random person. Oh, and then we're also going to do our stepping reflex. So for this, they're going to want to step just like this. And that's like our walking reflex. And then again, like drop, that's the Marlowe reflex. They should be kind of startled when you do that, but again, don't drop the head while you do that either. Temperature. Okay. And so for my teaching point, I'm going to do car seat safety. So for a car seat, flat obviously right here, be able to fit one pinky in, shouldn't be able to pinch it down. There should be no fluffy stuff right here on the arms. That could be a choking hazard. You want them to be rear facing in the back seat, hopefully in the middle. That would be best case scenario. For the baby, you're going to want to check the expiration, or not the expiration date, but make sure that there's no recall on the car seat, and just teaching that all to the family and like how to keep your baby safe in a car seat. And yeah, that is my newborn assessment.